Family. No matter what yours looks like, the men in the picture, fathers, brothers, husbands, sons, play important roles in our lives. But every year, Belizean men are disappearing simply because they're not going to the doctor. No one knows exactly how many Belizean men are walking around with cancer, but medical experts do know that our male population is especially prone to prostate and colon cancers, cancers that can be treated and even cured if diagnosed early.
I would never believe that I would have ended up with something of the sort like that.
In late 2010, 61-year-old construction worker Anthony Neal noticed he was going to the bathroom a lot more than usual.
You know, I'm a person that drink a lot of water, so I figure more or less, well, it's the water. Whenever I try to pee, I can't. I was like, I hold on to the post and shake, you know, to try to get it out. You know, it burns. Not too far after, about weeks after, I really start feeling pain. So it was near to death.
Medical tests subsequently revealed Neal had prostate cancer. With the support of his family and friends, Neal underwent surgery. He emerged from the experience with a deeper appreciation for life and doctors.
Dr. Ragama told me, he said, Mr. Neal, he said, I don't know what kind of man is you. He said, you're a lucky person. He said, because your cancer is old and your cancer was supposed to have been already spread to your bones and to your lungs and to your liver. He said, but for some reason, it didn't spread.
Today, Neal is cancer-free, and he wants his male peers to get help before it's too late.
It's not time to be afraid or be ashamed. You know, shame is not a good term to even use. You ask yourself, what do you prefer? To be shamed or to have your life? Which is it?
Prostate cancer is one of the most survivable types of cancer, if detected early. But the fact is, Belizean men are shying away from cancer screening tests. Doctors say it's not the blood test or even the ultrasound scaring men off. It's one test in particular, the digital rectal exam, or DRE.
Essentially, we introduce our index to the rectum and trying to palpate the prostate to see if it's an enlargement of the prostate. You know, it's uncomfortable. We don't want to pass through that test, but obviously it's part of the test. It's part of the examination that we usually recommend.
It's such a quick examination, then by the time it takes longer to go to the dentist and have a root canal or a simple extraction. You know, it's a matter of seconds that you will be embarrassed, and the information that you get from that examination is so helpful that I think it's worth the embarrassment, if you want to call it.
Another cancer common in men that can be cured if detected early is colorectal cancer. Diagnosis requires a colonoscopy, a procedure even more invasive than the DRE.
And whether you're a man or a woman, you should get your first colonoscopy at the age 50. Now, a lot of men, in particular, because we're talking about men here, tend to put that off as long as possible.
But according to gastroenterologist Dr. Irvin Gabriel, the benefits of the test far outweigh the discomfort of the procedure.
Colorectal cancer is a silent killer. By the time you have symptoms, the disease could be well into its progress already. We're talking stage 3 and up. Remember, you have stage 1, stage 2, stage 3, and stage 4. So by the time you're getting these symptoms of abdominal discomforts, rectal bleeding, bloating, pain, we're talking about an advanced disease. And unfortunately, there are many, many cases who come at that stage and expect miracles thereafter.
Retirees Norris and Sandra Hall started looking out for cancer years ago. Their routine of annual checkups paid off in 2011. when Norris's doctors detected an early stage of prostate cancer.
It was not a matter of fighting cancer, it was dealing with a situation I had in a positive sort of way. I believe if I had decided to fight, quote unquote, fight cancer, that would have been a stressful, awful experience. I took it hour by hour, day by day.
First of all, I always said, we have cancer. Because for me, it wasn't Norris's journey. It was our journey.
The couple explored different treatment options before deciding to undergo surgery in Belize City.
I was awake and I felt when they made the incision, and I felt the entire operation for 4.5 hours. It was a surreal experience because, as I describe it, it was like sitting behind the driver's wheel of my car. My car had broken down, and we had 3 mechanics working under the bonnet.
The surgery was successful and recovery was remarkably rapid. However, the Halls know they must remain vigilant.
Yes, there is that fear that it's going to come back. And the fear is not, okay, he may die. We all have to die, and we accept our mortality. But it is, as you get older, it becomes a bigger challenge dealing with that illness. Because, for instance, when Norris had his surgery, I was the only one here to look after him.
The Halls have insurance, but the frightening reality is that for too many Belizeans, even the costs of the cancer screening tests are too expensive.
If you cannot afford it, you don't have access to those services, then that means you won't get that service. And people make those decisions in Belize every day. Every day they make those decisions. No, I'm not going to do that because it will take money away from my family. My children need to be educated. They need this and that. Let's start from health. Visiting the clinics just for an annual checkup. Those services are available at the public health centers, free of cost almost, or at a very minimal cost. Of course, it's always available in the private sector. But with the aspect of our poverty levels in Belize, we must advocate for the use of our public health system. And that system is well equipped with specialists that you can be referred to.
While advances in medicine are ongoing, there is only one oncologist working in Belize, Dr. Ellsworth Grant, at the Belize Cancer Center in Dangriga. It's a situation that the Belize Cancer Society insists requires urgent attention. They are calling for a national comprehensive plan to make tests and treatment both accessible and affordable.
For cancer care, you've got to look at the services, screening services, and vaccines and so on. You also have to look at x-rays and so on, but you also have to look at surgeries and other interventions, and of course, chemotherapy and radiation at least at a basic level.
Healthy lifestyle choices may improve your odds, but the clear and present danger is that cancer can strike anyone, anywhere, at any time. So you've got to go looking for it. Know your family history. Talk to your doctor about changes in your body. And most importantly, get your cancer screening tests done.
Cancer is not as visible. And that is the thing that really people who develop cancer feel betrayed, because they say, I'm eating right, I'm doing everything right, but I still have cancer. That is the point, that really you don't know.
And there is no point in asking the egotistic question, why me? It doesn't make, you begin to feel sorry for yourself. Take a positive approach. Don't fight cancer. Just deal with the issue of cancer in whatever possible way you could. And cooperate with your physicians and your other medical advisors.
With Belize man, they're scared a man touch them or touch their private, but you can't live like that. I will tell the man them today what you want to do. You want to be ashamed and end up with a bag at your side that you will never have sex again in your life, or have a chance to at least have it if you use a little Viagra or whatever, which do you prefer? Not to have it at all, or at least go have it with a little helper? So get off your rear and seek help and stop that shine thing. That shine thing is past.